Good afternoon, everyone. Thank you so much for joining us again today during our workshop, Ensuring Quality Care, Assessing Bilingual Staff Competency. Just to get us started, for those of you who may not be familiar with the National Center for Farmworker Health, we are a private nonprofit organization located outside of Austin in Buda, Texas. And our mission is to improve the health of farmworker families. And we do that by providing different programs, trainings, and technical assistance and different resources. We did celebrate our 45th year anniversary in 2020, and we're very proud to be able to serve various different community health centers and FQHCs within our network. Next slide, please. The Ag Worker Access campaign was launched in 2015. It was a joint effort by the National Center for Farmworker Health and the National Association of Community Health Centers. We, along with the health center staff and other ag worker advocates, knew that more could be done to increase access to quality healthcare for America's agriculture workers and their families. So the result was this Ag Worker Access campaign. We have seen a very steady increase in the number of ag workers served in health centers since the campaign's launch back in 2015. And in 2021, we surpassed our halfway milestone of 1 million ag workers served. Unfortunately, in the 2022 UDS data, we did see a decline, but we're very confident in the hard work and determination of health centers across the country that we continue growing from there. But we do need your help, so please feel free to access the link for the iWorker campaign that you see on the screen and join. And next slide. My name is Megan Martinez, and I'm the Health Initiatives Program Coordinator here at NCFH. Next slide. Okay, so to just kind of thank you again for joining, and just to get us started, we really would like to hear from you. So if you could please plug into the chat, or if you'd like to unmute yourself just for this question, let us know what your name is, what state you're joining us from, the name of your health center or organization, and let us know what drew you to today's workshop or what you hope to gain today. So we could see a few responses in the chat, or again, feel free to unmute yourself if you'd like or you prefer.
Um, I can go ahead real quick. Can you guys hear me?
Yes, thank you, Jaden.
Hi, my name is Jaden Bowman. I'm in North Carolina. I'm at a FQHC or federally qualified health center, Piedmont Health Services. I'm a talent acquisition business partner, so I do a lot of our recruiting. And we do hire for ag worker specialists at our FQHC. So what drew me here today is just learning more about how to, assess and validate bilingual competency with our staff and our providers that we hire for. Thank you.
Okay, thank you, Jaden. And then I do see a couple of people in the chat. Well, Kyria, I hope I said that right, works at East Georgia Healthcare Center in Georgia. Judy, a health promoter in Kansas. Maria, again here in Austin with NCFH. Beverly, Finger Lakes, welcome. Julie Thomas, North Carolina Neighborhood Center. Karaima, I believe, I hope I said that right, from Washington State, welcome. Dewey, HR Director, Health and Wellness in Martinsville, Virginia. Have bilingual staff and translators and wanted to find out about assessing competency. Perfect. Thank you. Jocelyn with Mountain Family Health Centers. Ellen with Delaware Department of Labor. Ileana with Sumter, South Carolina Community Health Center. Tina, welcome from Kansas. And Kayla from Tatum Health. Thank you so much for letting us know where you're joining us from, and hopefully we're able to get some great information for you here so that you can take back to your health center, to your organization, and your staff. Feel free to continue plugging in your information to the chat if you have not yet done so. Okay, next slide. For today's learning objectives, we hope to identify steps to assess bilingual staff competency and demonstrate the ability to recognize competency through role play scenarios. We hope to understand different level of proficiency and implement best practices to ensure accuracy in bilingual assessment and develop strategies for bilingual staff to effectively communicate with various patient populations, considering language, health perspectives, as well as family dynamics. Next slide. All right. So in the chat again, or again, if you'd like to unmute yourself, can you tell us a little bit about what are your thoughts on why language access programs are necessary in a healthcare setting? What is the importance of language access?
For clear understanding of their health.
Yes, Joanna, thank you. So that we can have clear understanding, no misunderstandings, better healthcare outcomes, right? Um, Meeting members where they're at. We find it very important to make sure our patients and staff understand each other. Yes, so important. So they can reach out to us knowing we can help in their language. Yes, we want to make them comfortable. We want to provide a space for them where they want to come in and see us, right? Where they want to address their healthcare concerns. Perfect. Thank you all. And we'll get a little bit more into that as we continue on. Thank you, Vanessa. And this one, I think you have to do multiple clicks because, yeah, thank you. So now we go into the importance of language access and patient safety. And some of you mentioned that as a reason why it's important, right? Um, and this can include adverse patient safety events. It's important because we don't want there to be patient misunderstanding, maybe their diagnosis, maybe misunderstanding directions of how to take their medications, or anything having to do regarding taking care of their health. Um, Importance of language access programs as patient safety is also very important because without it, we do have an increased number of negative healthcare outcomes. We may end up seeing higher emergency room and readmissions because maybe they were misdiagnosed due to the language barrier or to misunderstanding or not being able to comprehend their diagnosis. Maybe they were taking, again, their medication wrong. Maybe they were given the wrong medication due to that language barrier. So they end up having to go to the emergency room or just be readmitted. Um, More malpractice lawsuits can also come of lack of language access programs. Again, because there can be misdiagnosis. And just that lack of understanding, and thus patient's assurance and willingness to return, right? Many of you mentioned that one of the biggest importance of language access is to make the people feel, your patients feel comfortable, right? Comfortable to open up to you, to make sure that there's a level of understanding between the two, right? Next slide, Vanessa. So then we go into implementing a language access program, and this has various different steps or components that we have to consider. What assessment is being used to assess competency? How is it being used? Does the assessment accurately assess the skill set of the staff members based on their different roles in providing language access services? What needs to be revised to improve the process to fit the current needs of your health center staff and the patients? Who are the staff currently involved in actually administrating these assessments? So these are all things that you have to think about, including what resources do you have available? What is the budgeting look like for you, right? What are the policies and procedures that you have in place? What do your patient demographics look like? What type of trainings does your health center have in regards to capacity that they're able to provide? And then I see that Maria plugged a resource into the chat, the Implementing Language Access Program resource, and you'll see the link for it here. Feel free to open it via the chat so you can take a look at it. Next slide. Yes, thank you. Workforce capacity, bilingual skills. So these are different ways to check. You can use language competency checklist. You can use proficiency test, language assessments, just so that we can kind of gauge where we're at here with this group. Can you tell me, maybe plug into the chat as well or unmute yourself, what assessments are being used at your health centers, if any, or that you know of?
We actually used a tool that you developed, the NCFH tool.
Oh, nice. Perfect. That's
Yes.
nice to hear, Juana. Has it been very helpful?
Yeah, it has, because now, we didn't assess the fluency of the patient or the staff and the medical knowledge. So now we do at the very beginning on the onboarding, and then a month later we reassessed. So it's been very helpful for
Oh,
us.
that's great. It's nice that you have that process in place.
Yes.
Um, Someone else said they recently used the Alta Language Services. Again, also Alta, but struggling to find an assessment that is equivalent to CCLA for the behavioral health and dental departments. We can take a look at that to see what we can find for you, Jocelyn. Someone else, we use Alta in Period. Okay, so it sounds like Alta is one that's frequently used. Perfect. Thank you guys for sharing. So we have two poll questions here that'll be pulled up in just a minute. If you all can please answer those first two. Does your health center currently assess bilingual staff skills? And some of you have already let us know that you do. Do you have bilingual staff available at your health center? We know that sometimes due to resources and budgeting or just maybe lack of individuals who are bilingual that are applying in different maybe rural areas is hard. So yeah, we just want to kind of get an idea of where your health center is at. Do you assess for bilingual staff skills, and do you have bilingual staff available? Okay. Oh wow, 100% do have bilingual staff available at the health center, so that's great to hear. About 69% currently assesses for bilingual staff competency, 31% currently do not. Okay, well, that's good. These are great results. I'm glad that most of y'all or all of y'all who did respond do have bilingual staff available at your health center. So those of you who answered that you do currently assess your bilingual staff, how are the assessments being done? If anyone would like to share just a little bit about the process at your health center, how are the assessments being done, and maybe who's conducting these assessments? Do you have a team of people that are doing that, a specific person that's doing that? It's nice to bounce ideas off of one another. I see Beverly raised her hand. Beverly, you can go ahead and unmute yourself.
Trying to unmute myself. There we go. We do a little bit of both. So we started, 20, 30 years ago doing assessments with bilingual staff that we already had on board. We moved away from that 2 or 3 years ago just to make it transparent and not show any favoritism. We didn't want to get political in that sense. So we started hiring Alta. The situation also is that Alta is more expensive. It also is a little bit more fast-paced. So having a conversation many times is enough for us, especially at the front desk. We want to make sure that the patients at the front desk, the people that work at the front desk can communicate. And, it's not a speed test, but just a conversation. So we moved away from Alta for the front desk, and we're using Parrot. And Parrot has, I don't know how many languages, but a bunch of languages. So now all the testing is through a third party. And it still is a team. We assess the results and we see if it was something that, like, if we've had a conversation with a person and we know that they actually do speak the language, but they failed the test, then we know that maybe it was the technology that failed. They're not good test takers. They get nervous, whatever the situation may be. Then we try to figure out another way to assess that they speak the language. But right now, really, the majority of the testing goes through Alta and through Parrot.
Okay, thank you. And do you do different types of testing, like verbal, written?
So right now, everything is verbal until we get to the teams that are doing translations, for example. And then the written, and still it's not, it really isn't written. It's verbal and reading. Um, for the people that take Bridging the Gap, because they do have to do site translation, so we need to make sure that they can actually read documents.
Perfect. Thank you, Beverly, for sharing.
You're welcome.
Anyone else would like to share your experience or what it is that you're currently doing, what your process looks like? Maybe what's worked, what hasn't?
Here our health center, we do just in-house. The person that trains the front staff is the one that, our patient reps mainly are the ones that does the interpretation. So the person that, trains the front staff, she does the bilingual checking skills.
Oh, good. So it sounds like maybe there's a person per department.
Mm-hmm.
Does
Yeah,
it sound
it's a trainer.
a trainer? Okay, perfect. Thanks, Joanna.
You're welcome.
Anyone else would like to share before we move on? Okay, well, thank you all for sharing. So this is the Assessing Bilingual Staff Competency tool that we created here at NCFH, and I know that some of you, I believe Joanna mentioned, using it. And this guide is really meant to serve to help you start assessing bilingual staff skills and or maybe to improve on your current practices that you already do have. Maria is going to be dropping the link in the chat. And if you open this link on your end, you'll see that within the guide, there's various different templates for you to utilize or to reference if you'd like to just kind of build upon your own templates. I know that a lot of times your health centers already have templates that you already use, but if you don't, there's no reason to recreate. We have a couple that we have provided for you to use. There's also like an assessment and planning tool, the sample assessments, language proficiency test, kind of examples of different ones, and a couple of other resources for keywords and phrases that may be helpful to staff when speaking to patients, and just a couple of other resources that you can reference. So again, Maria will be dropping that link in the chat, and then we will also share it with you via the follow-up email. So let us know if you do have any questions. I do see a comment in the chat. I'm curious to hear about alternative testing methods. We recently had a physician that tested with Alta but did not pass. It was a medical terminology section that she missed. For those that use Alta, what do you do when someone is reported as being not proficient? Would anyone like to share? I know many of you mentioned using Alta. So those of you who do use it, do you have any guidance that you can offer to Jaden? What do you do when someone is reported as being not proficient? Maybe
So
specific. Mhm.
go ahead. Sorry.
Go ahead, Beverly.
Oh, with us, if they do not pass the test, they must use an interpreter. And we have seen that actually that exact same thing is that they speak the language, they can communicate, but when it comes to medical terminology, they can't. And for us, you can't tell a patient, well, you have something, but I don't know how to say that something in your language. And I'm going to send you for some tests, but I don't know how to say those tests in your language either. You have to be able to communicate with the patient, telling them what their condition are, diagnosis, tests, etc. So they must use an interpreter. If they do not pass uh, at the proficiency level that is required, then they have to use an interpreter.
Thanks for sharing, Beverly. And just curious, at any point, do you retest the individuals?
So we have retested some individuals when we think that, for example, they weren't prepared, that they really didn't read instructions. So many times providers, it's amazing how many, providers are very busy. So they receive an instruction, an email, they just say, I'm going to just go and take the test without really preparing. So we have had that happen where we say, okay, retake the test, make sure you're understanding all the instructions. But I would say that all the providers that have failed, it's the vocabulary, it's the terminology. They can have, a regular conversation if they're a tourist somewhere and ask for a cup of coffee or where the hotel is, things like that. But they cannot, they don't know all the medical terminology in the target language. So they have to use an interpreter. And we don't retest them unless they say that now they have learned all that medical terminology, which in many cases they don't even have the time to do.
Yeah. Thank you, Beverly. I hope that helped, Jaden. Next slide, please, Vanessa. Okay, so now we go into, if you are looking at the guide or if you have taken a look at the guide, you'll see that we're going to go through kind of each of the steps within the guide. So step one is to evaluate the process in place. And again, like we mentioned, we have to think about what assessment is being used. We have to think about what staff are we assessing, right? Is it front of house staff? Is it physicians? Is it community health workers? Whose bilingual competency are we assessing? And how can the process be improved? Um, so we're going to dive into that a little bit here. Next slide, Vanessa. So we're gonna start by identifying proficiency levels, right? There's different types of skill sets, like some of us mentioned. There's the basic skill set, independent, and proficient. To assess patient language needs, we have to identify the language spoken and the type of support needed through patient needs assessments, right? The ones that we do at the very beginning, through chart reviews, through staff interviews and surveys, through screening for language barriers. You should be tracking the number of patients that need language access support and determine at what points during the clinical visits do they need that language support. Track the number of bilingual staff and their roles in providing language access support. We should be able to define the levels of language proficiency to assign staff based on their individual skill set. So for example, the basic level, in this level, staff can help with, the simplest of questions, like simple interpretation for scheduling appointments, maybe talking on the phone after patient visits. And then we move on to the independent level, which is the more like middle one. Staff can do more here. They can explain a little bit more about the patient's health information. They can help a little bit more with the patient understanding of the healthcare system better. And then at the proficient level, this is where the staff can interpret during clinical visits with providers and make sure that the patient really understands the important medical information that they're receiving. And then lastly, we should be able to establish baseline criteria for each language proficiency level. And on the next slide, we go into establishing that baseline criteria for each level. So areas to be assessed, we talked about speaking skills, right? Listening skills, writing skills, and reading skills. And each of these skills, next slide, are assessed based on that basic level, independent level, and proficient level. So at the basic, it's a basic welcomes the patients, listens and understands patients' concerns, document patient information, like their name, date of birth, rate their medical records and documentation. And then the independent goes more into the explanation of it, more into the in-depth understanding, explanation of medical conditions, understand and gather all the back history of the patient's medical history, actually be able to write accurate medical notes and reports, and review and interpret health education materials that are provided to the patient as resources or as supplements to take with them home. And at the proficient level, able to really have detailed medical discussions with patients. Again, understand medical discussions and questions. At this point, individuals are able to create and translate health education materials properly, able to provide teach back method for health education and instructions to better help the patients gain understanding of what is being explained to them. And then continuing on with the baseline criteria on the next slide, we go into the medical terminology. So here in the independent and proficient levels of medical terminology, you really just have an understanding of the medical terminology. Maybe you can accurately translate and explain the medical terms, and you're proficient in documenting and communicating terminology. And then it can be a little different, right? For like pharmacists, medical providers, here for you have to provide accurate interpretation during the actual patient visits. Also understand medical terminology and patient language, and experience with medical terminology in patient language. So maybe by unmuting yourself again or via the chat, I know that some of you also spoke of some people having difficulty within those medical terminology terms. So what are some of the most common medical terms that you have seen your staff or even the patients have most trouble kind of communicating or understanding or translating? Some of those tough common terms that you frequently hear? All medical jargon, especially I would say like, yeah, medication names, medical jargon. Anything else? Acronyms, yes. So many acronyms for everything, and we really have to make sure that we aren't using those with any of our patients, because what we may know, they may not know. Anything else anyone likes to add? Medication names, yes. Sometimes I can't even pronounce them in English. Specialist. Mhm.
Megan, and
Yes.
if I can interact a little bit here, as I was listening to you, something came to my mind that I wanted to share with everyone. So I'm a native Spanish speaker. I was born in El Salvador, so I have a good level of Spanish and a considerable good English. But if for me, I was thinking, oh my God, in my case, I don't think I even working in healthcare and around healthcare. Uh, Different areas, I don't think I could be a medical interpreter because I don't have that capability. And there's still some words uh, and some medication and some diagnosis that I don't know how to translate. So from one to language to the other, or vice versa. And also thinking, for example, of my children, I was thinking, well, they say they're bilingual. My kids say we are bilingual. But I would even question their capability of reading, uh, or even writing, right? Is in Spanish. They speak Spanish with probably little accent, but but it's a completely different thing to read and write and uh, speak. So just getting that thought out there, the basic question that we ask always is, are you bilingual? Or do you what other languages do you know? And the proficiency level is not well defined many times.
That's a great point. Thanks, Maria, for sharing. Yeah, and that goes back to the reason why it's so important to truly assess that kind of level of proficiency, because just because sometimes we can speak Spanish or another language, it doesn't necessarily mean that the person can maybe write it or read it as well. So yeah, very true. And then I also like what Ellen mentioned, that there's a variety of a word, variations of words and its meanings by country and or regions. So yes, the same word can be translated in different ways for different people, with it still meaning the same thing. So yes, very true. Thank y'all. Next slide, please. So now we actually,
You have a hand raised.
I'm sorry, I missed it. Jaden, go ahead.
Oh, sorry. I was just curious, and perhaps this is probably going to be discussed later, but I'm curious for those that do test, because right now our FQHC, we do not have a formal policy to test our employees. This test that recently occurred with the doctor, she kind of requested and asked herself to be tested, but I'm curious for those that do test. Do you require the candidate to test before they are offered the position, or during the offer stage, before they start? Do you test them, on their first day? Kind of at what stage do you ask for that testing? Because we do have roles where we say, hey, we want someone bilingual, but we don't at this time have processes in place to test them. We kind of just, assume that, hey, if they're applying and they speak Spanish, they're getting the job. So just trying to establish that kind of timeline of when that testing should occur.
That's a great question, Jaden. Would anyone like to shed some light on that or have a response for that?
So this is Beverly again. If the position is truly bilingual, we test beforehand, before they've signed a contract. If they don't speak the language, but we would still hire them, then we can do it afterwards. But if the position says bilingual required, we do it before we even have them get in the door, because then it's so much harder to say, well, sorry, you didn't pass the test, but thank you. And now you've relocated to this area or whatever the case may be. So we do it before they even sign a contract and decide to move. We want to test them. And the providers themselves are actually, I would say that for about a year, 2 years maybe now, providers are aware that they're going to be tested. It kind of seems like it's starting to become the norm. If they're saying that they're bilingual, we don't take it just we don't take their word for it. We have to have them tested.
That makes sense. And I think that's kind of how our organization is starting to align. I'm fairly new with the organization, and just with, current, things, we just want to make sure that moving forward, we're operating more efficiently, and having that validated rather than just believing it. Because as we know, there's so many different levels and differences there. Thank you.
You're welcome.
Thanks, Beverly. Thanks, Jaden. That was a great question. Okay, so now we move on to step 4, which is identifying and assessing bilingual staff that can offer language access support. And we can test these proficiency levels in different ways, right? We can do it through guided oral assessments, and this can look like, for example, role plays where the staff member leads a mock patient scenario in the preferred patient language. We can also conduct actual written assessments by using maybe get like a case study where the staff member has to interpret the study and take notes of their interpretation by writing it down, again in the preferred patient language. Or we can use verbal assessments, which many of you mentioned using. And that can look like having the staff member maybe read and interpret a specific document, or maybe do the same with an educational material or resource that they would most likely use with the patient. Um, and again, doing that is in the preferred patient language. And also, it's not only important, but there are also lots and lots of benefits to having certified medical interpreters, as was mentioned here, also available at your health center. Sometimes some of the benefits the medical interpreters have is for the health centers is both for patients and providers, because like we all mentioned, medical interpretation can be difficult at times, even if you are fluent in a patient's native language. Um, and we have lots of different resources for that also within the guide where you can find medical interpreters. So feel free to look at that. Um, and next slide, Vanessa. Okay, so step 5, moving on. We designate staff based on their role and proficiency levels to provide language access, right? This is where we start having conversations with different staff about their skills, their skill sets, their proficiency levels, and what areas they can support. So at this point, you've assessed different staff members working in different departments within your health center. And you start to develop a plan, right? You start having these conversations. Um, and via the guide that we shared with you again, there's also additional resources for providing additional competency assessment resources. There's like I think we included in there, interagency language roundtable. It's an assessment tool for speaking, reading, and listening. We also included the national standards class in health and healthcare, a guide to providing effective communication and language assistant services. Um, so those are really good support resources once you've reached this step when assessing your staff. And then next slide. Here we get, I just wanted to briefly talk about kind of different strategies for effective communication with every patient. And I'm sure, these are all things that staff at your health center are already doing. We want to consider language and educational levels from the patient. We want to consider individual health perspectives, consider diet preferences and restrictions, and maybe varying family dynamics and traditions, right? So maybe, for example, when it comes to language and educational level, some of the strategies that can be used is remember to always use plain language. Like we mentioned, avoid using jargon, avoid using acronyms. Um, Keep it simple, right? Like instead of using words like hypertension, maybe use high blood pressure. Um, we found that patients also if they maybe have lower reading level comprehensions in whatever language, the use of visual aids, pictures, diagrams, charts, may work better, especially when they have limited English proficiency. Um, Remember to use interpreter services when needed and if available, because sometimes the patient may, if there's no interpretation available within the healthcare staff, then maybe the patient will rely on family members, and sometimes that information can get misconstrued, or there may be a disconnect. Um, Another really good thing to do is use the teach back method. So remember to always ask patients to repeat the information in their own words, in their preferred language, just to confirm understanding on both ends. And then again, anytime you're providing patient material, remember to do it in the patient's preferred language, because if the patient doesn't speak English and you give them an English flyer, then it won't be of any use to them, right? And then when considering individual health perspectives and diet preferences, it's just always good to ask open-ended questions, right? Like maybe, why do you think you're having these symptoms? Or what have you been doing differently? Or remember to be just very non-judgmental, respect varying views, um, incorporate their own beliefs and their own concerns, their own traditions that they may mention through those open-ended questions, and just recognize the limits of knowledge, and also show your willingness to learn from the patient as much as the patient's willing to learn from you, right? Because they know their background, and we're asking these questions to try to get to know them. And then when it comes to diet preferences and restrictions, just acknowledge their dietary preferences, acknowledge the types of foods that they eat, acknowledge maybe their restrictions, maybe they choose to be vegetarian or whatever may be. Maybe they may choose to fast, or maybe they have a gluten intolerance. So just be aware of all of that and provide nutritional advice that aligns with the patient preferences, right? And then family dynamics and traditions, just remember to include them in the decisions. Sometimes extended family, those in the household. So maybe they, I don't know, choose the meals that they have based on what everyone in the household eats. So just make sure to consider that when providing nutritional advice, for example. Um, Involve the family if you can, if they are involved, in their health. Um, and just be aware of their transportation needs or medication needs, if they have access to get to their appointments, just to be able to provide that whole health care. And then next slide. So a lot of times you all may see this, patients who may have limited English proficiency, maybe you'll see that they're confused about their medication and how to take it. Sometimes they have a lot of trouble understanding what their illness is and what it is that you're trying to convey to them. Sometimes maybe they feel anxious or they get anxiety during their visit to the health center. So maybe they decide, oh, I just won't go. I'll just get my appointment. So they prolong making their appointments or making the visit to the health center, and then maybe a detriment to their health, right? So when it comes to confusion about the medications, a lot of times limited English proficient patients may misinterpret dosage instructions, the timing of taking it, maybe the reason or purpose of why they're taking the medication. Maybe they can confuse the medication with other medications that they're taking. A lot of people do, take various different medications. Sometimes they choose not to take them because, they're scared of the side effects that it may have on them. So it's really important, again, to go back and use that, check for understanding, use the teach back methods, use the different things that you already probably are doing at your health center, your staff is doing, but these are just good reminders. Maybe they can suggest they use pill organizers, maybe do demonstrations for them of how to take the pills, when to take them. Sometimes they have trouble understanding their illness, like I mentioned. Maybe they don't know how severe their condition might be, right? They might get frustrated because they don't understand. So, things to consider again, when individuals have limited English proficiency. And again, always remember to use certified medical interpreters when needed, just to make sure that you're providing the most accurate information possible to help relieve the anxiety or the frustration on behalf of the patient. Um, Yeah, and just create a really welcoming environment. Ask the questions, provide clear instructions, and just remember to assess all your staff to ensure that they're proficient enough and competent enough to assist the patient in the best way possible in their native language. And then next slide. To wrap up this first part of our workshop, I will leave you with this quote. Communication is an essential part or component of healthcare. And on the next slide, thank you all so much for attending. For any questions or technical assistance needs, please feel free to reach out to me, Megan again at martinez@ncfh.org. For those of you that are joining us in real time, please stay for the second portion of today's workshop. We'll be doing some hands-on activities. And for those who are listening to the recording, thank you so much for joining.